So I'm Kristy and I'm a physician innovator. And from the time I was a little girl, I wanted to be a scientist. It seemed a little unlikely at first. My dad was a truck driver, my mom was a preschool teacher, and neither one of them had went to college. It seemed more unlikely every time I looked in a textbook. All of the scientists I saw, they were all old men. They weren't young women. When I looked around at college, they really weren't women either. Lucky for me, I had a family who said, it doesn't matter. Maybe you'll be the one in the textbook. Maybe you'll be the one that the next girl will look at and say, that's who I want to be when I grow up. And for some reason, I listened to them. And I found myself in this amazing world where I get to blend health design with engineering and research. And for me, it's been an amazing journey. I get to go out there and see patients and meet other doctors and talk about what we need and what we want in medicine. My research over the years has focused on tissue engineering and regenerative medicine, which is the idea that we can use cells and biological materials to develop or repair human tissues. And my early work in this field revolved a lot around making the biomaterials, the sponges, the environments that would allow stem cells and other cells to transform and produce different tissues in the body. And as technology now advances, instead of those simple sponges, we can create increasingly complex 3D architectures with cells that can mimic the humic form. We now literally are starting to print tissues, bone, muscle, cartilage, and I propose that we can use 3D bioprinting to change the way that we practice medicine. What if an orthopedic surgeon could drill into a near replica of a patient's brittle bone prior to surgery, and then realize ahead of time that that screw just won't implant in that space? What if the model an ENT doctor uses to train residents in handling surgical instruments looked and felt exactly like what they would see in their surgical case the next morning? This is where I think bioprinting research could have such an incredible impact on the medical world. Today, when my surgical colleague has a difficult case, I can make them a 3D printed plastic model of their patient's anatomy and use whatever MRI or CT scans they have. And that's pretty good. But tomorrow, I want to hand them something better. I want to take that same clinical data, and instead of handing them plastic, I want to give them the highest fidelity prototype imaginable. Effectively, I want to put their patient's tissues into their hands. I think this research is so important because it doesn't just teach us something new, but it allows us to teach in a new way, to train our future doctors differently, and to keep training them. The medical students in the lab making prototypes, the resident using them to learn how to perform surgery, and even the expert surgeon who can now appreciate and anticipate individual patient complexities like never before. This is where I see my impact, at that cross-section, where engineering, design, medicine, and education all come together. Personally, I am honored and excited to be developing as a leader in STEM. Thank you for believing in us, for believing in women in these fields. I have no doubt that I will change the face of science, not just through my work, not through my individual bioprinting research, but by inspiring a future generation of students to become scientists and innovators themselves. I am beyond excited for these next steps in this incredible journey, and I invite you to take them with me.